one of our go-to experts has always been Dr. Scott Miscovich of the COVID-19 Task Force and also of Premier Medical Group Hawaii. Good to see you again, Dr. Miscovich.
Thank you. Good to see you, and happy Easter to you and all the people that are watching. Hopefully are enjoying this day with their family in the midst of this crisis.
Yeah, happy Easter. I know a lot of us still concerned about what's happening. Let's talk about Maui. I know there's been a lot of attention on what happened specifically at Maui Memorial Medical Center. What can you share about what you saw on the ground there?
Well, again, I would tell you that the morning that this outbreak of 15 was announced, Mayor Victorino called me early because we were already planning going over. He accelerated our trip over there. I had a team together. I would call it my A team within about 8 hours, and we were on the ground. We then proceeded to do 2 full days of testing up in Kahului, where we tested close to 1,000 individuals there, another 450 down in Hana, which was very receptive. And looking face to face to all the people on the ground, there was fear, there was concern, there was a fear of isolation. There was just a lot of uncertainty in the population. And sometimes we had a drive of about, there was at least a mile and a half queue and maybe 500 to 700 cars. So bottom line in Maui, a lot of the healthcare workers we took in, it was clear they didn't have the proper protective equipment that should have been used in that situation, but we're not looking backward there. And I think we really had a good sampling, and we're going back. So we have a tremendous amount of support by Mayor Victorino. We have a tremendous amount of support by all his staff on the ground, and also the Maui physicians and providers are standing up. So we're back full force this week in Maui.
Yeah, we talked a lot about this last month, about kind of the need to really protect all our frontline workers. And this has really become the poster child of what not to do. And we're hearing a lot of, concern on the ground from people writing to us, people who work in the hospital, saying that they really don't feel protected. So what can they do if they just feel like their employer isn't supporting them?
Well, I mean, I do believe that it is imperative that the employer frontline tests. And I'm going to give you an example. Tomorrow is Monday. All of those people you see in PPE on TV, which are all my staff out there and volunteers, they all are going through testing. Every week I am testing my frontline volunteers, which is basically following guidelines for a public health infection crisis. When you have people who are putting their lives on the line, you have to protect them. Second, if you also notice, our frontline workers have very high quality PPE, which we're buying and finding. And, I want to make a very big distinction. Sorry, my family's barking in the background. I want to make a very big distinction that there is this myth that there's no PPE in the state. PPE is available everywhere in this state. You could buy literally millions of masks. We just have a donation of 10,000 coming. I just ordered another 5,000. So there is no excuse for any institution to not have the proper gear for their employees in any hospital or clinic in the state of Hawaii. They can't just sit and wait for the federal government to dole out the supplies that are free. They need to go and buy it to protect their employees. Every employee in the hospital should be wearing an N95. I don't care where you are, if you're walking amidst, and most everybody there just had a plain surgical mask. Some research from today just shows again that surgical mask will not protect them as an employee. So N95.
Why are we hearing so much, though? I just wanted to ask you about that, Dr. Miscovich. Why are we hearing so much about a shortage then, if there's so much available?
It is so disturbing to me that this is being promulgated through many of our top officials in the state and hospital employees, and it is just outright false. I could right now send you probably 6 or 7 very valid offers to have. Literally, you can't buy less than 50 to 100,000 of these, whether it's N95s, the shields, the full gear. It's available everywhere. The world production has kicked up to now produce this. And so I think what they're trying to do is it's trying to sit there and force the federal government to release the stockpile so they get it for free. Now's not the time to sit there and wait in the soup line for free. Buy it, protect your employees. You've got to stand up for those people who are putting their life on the line.
Yeah, so important. And, I'm also monitoring our Facebook live here, looking at if anyone has any questions, feel free to write in. It's very important to, our medical expert here on the front lines every day, battling for us and trying to dismiss a lot of these misconceptions that are out there. We talked about the other neighboring islands. We don't see any cases on Lanai, for example. And I remember since you started testing on Molokai, we have seen some cases there. Tell us what's going on with those two remote islands.
We have a couple doctors over there trying to fuel the public to say that, oh, no, we got this covered. They've only done, I think, less than 35 or 40 tests total. It's statistically impossible. There are no cases on Lanai. They have this misconception that because no tourists are coming, that they will not have any chance, and because they have zero, they're safe. What we have seen in the last 3 to 4 weeks is the cases coming into the state are mostly being brought by our returning family and relatives and people that are moving back in from colleges, from school, from work. And let's face it, if you have people coming back home and you come into a home, and are you going to sit there in the room and not go sit and have dinner with your family or sit around and enjoy time with them? It's not that they're doing anything wrong, but that's where the new introduction is to our state. The same thing we have to understand for the entire state. Do not let its guard down to say, now that we've shut tourism down, that we're 100% safe from new introduction. All of us have family members. I have in my home, my son just returned from NYU with his fiance, and they just finished their quarantine. And, but the fact is, everybody has people coming back home or from travel. That's where our risk is. And the key is they have to be quarantined, and it has to be serious quarantine.
Are you going to be testing more aggressively there then in Lanai, for example?
Well, Lanai right now, the mayor wants us to go over. We're still kind of working on a process at this stage. There seems to be this opposition that they're also having this myth that they don't want other people coming over because we're going to introduce it into Lanai. Every one of my staff is tested and negative. Before you can go out and test the public, it's not only for their protection, but I don't want frontline people looking face to face, spreading it to the people that we're testing and screening. So I would also challenge the hospitals, which I don't think that any of them are doing right now, emergency room and intensive care staff at every hospital through the state and clinics and nursing care. They should be on a regular testing schedule. They should be tested once a week. And from my understanding, no one is doing that right now in the state of Hawaii.
Okay, well, I'm just going to look at, there's some questions coming in from Joyce Castillo, for example. She says, I'm doing heart surgery on Wednesday. Should I be worried about doctors and nurses that don't have the right protective gear?
I guess it's hard for me to comment without knowing which hospital she's going to. I do believe that the operating rooms are being very, very careful. So I would feel that the operating rooms are quite safe. Again, my feeling is what I worry about is how much are they testing those employees, because we know very well now that 20 to 40% or higher of people with positive COVID are asymptomatic and still can be shedding. This is one of the more concerning facts that we have now going across the world. And so unless you're testing, and yet as of yesterday, our Department of Health is still saying, they're denying this fact that it even exists. They're saying, no, don't test. You don't test asymptomatic. You don't test close contacts if they're asymptomatic. It's just there's such a massive divide between what the world knows and what is being discussed here at our local level by the leadership.
What side of the fence are you on then?
Oh my God, we need to be testing every
like widespread.
Widespread testing, of course. Widespread testing has been shown again and again throughout the world to be the only way that we are going to basically be able to get control of this. You widespread test, you get the positives, you track the contacts, you isolate, you quarantine, and you repeat. You combine that with social distancing, the masks that we're using, the shutdown we have a chance to be one of the other success stories in the world, along with Singapore, Germany, Macau, South Korea.
Yeah.
Yeah, we have a chance to do that. But the only way we're going to do it is follow the current literature, follow what's going on across the world, which is now aggressively screening contacts, whether you're symptomatic or not. Also take these high risk areas and begin to look at screening contacts. One of our biggest challenges, which is our tinderbox, just outside of what just happened in Maui Memorial, which is just going to keep spreading until we get under control, are all of our shelters here on Oahu and all of our group homes. They are critically going to need attention, and there is a big denial at all levels that we shouldn't even pay attention to them. But 2 or 3 of them, if they get the spread, just 2 days ago, San Francisco had 70 people in one shelter positive. We were just on contact with Dr. James O'Connell, the founder of Homeless Healthcare in Boston. He just screened one of his shelters. 0 people that were positive had a fever. Very few had coughs. He had 145, mostly asymptomatic individuals in the shelter positive. That is just something that makes us shudder. And here in Hawaii, we're not doing anything about it. We're not even addressing it. As a matter of fact, the shelter owners are all coming together, lobbying to say, no, stay away. We got it covered. No, we got this under control. And all they're doing is checking a temperature when someone walks in. We are
Wow,
really
so dangerous.
Very dangerous right now. We need to do something. We're going to need to thin out probably 80% of every resident in every shelter and group home if we want to prevent other very big clusters that will be very dangerous to our hospitals and our ICUs.
Yeah, last time we talked, you mentioned, that you thought that there could possibly be at least 1,000 undiagnosed cases on Oahu, or at least statewide alone. Are you still believing in that? What do you think that number could be at this point?
The epidemiologic people that I'm dealing with, which are really high-level experts, are telling that their data calculations are probably 3,000 to 4,000 statewide right now.
Wow.
So obviously, due to population data, that means we're probably dealing with that 3,000 on Oahu, and now with the outbreak on Maui, which is just basically, as we look back, Maui has been going on for a while. There have been a lot of positives throughout that hospital, and they really are. We're going to find it's going to have spread in many different areas. So, so just be prepared as the numbers come back from Maui. They are going to go up, but we have to aggressively check them. Like we're going back to Molokai on Tuesday. Wednesday, we're going to be back. I think we're Lahaina on Wednesday, Kahului again on Thursday. There's another team in Kahului this week, which is the Maui group, and we're back to Hana on Friday. So we're going to really be canvassing it. And again, I want to give shout out to Mayor Victorino. He is 100% behind knowing that this must be done, and is just saying, please come, because he believes that testing is the way, as does his staff.
Yeah, we really need to have that partnership with the government as well. I did have a question here from Kale Kaui. He says, can you explain the public-private partnership? Because obviously we know, Dr. Miscovich, you have your private practice, the Premier Medical Group, that has been doing a lot of these testing out in the community. But what can the state do to up its game, to put more skin in the game? Because it seems like your private practice is really doing most of this testing.
We are, and I want to also give a shout out to the volunteers. Since we started to do it, which was all my practice, I probably have another 200 volunteers that have selflessly stepped up. A big shout out to the APRNs, nurse practitioners. I have other doctors. I have just plain volunteers. The number of volunteers we have is tremendous. So this is a massive outreach by the private medical community to embrace the state. I think it's fair to say it's just the opposite. We've gotten great support from the mayors. Every mayor, we haven't been invited over to Kauai, but would be willing to go. But essentially, Mayor Caldwell here, Mayor Victorino, Mayor Kim have all been fine and helped us. It's exact opposite. The state behind the scenes is doing everything they can to shut us down, which is just ridiculous. So there is zero support from the state. We have zero funding. As a matter of fact, we're battling political influence from the state every time we turn around. And so we're not stopping. This is for the people. This is private. And when the mayors open up their doors to us, we're going to follow the counties because we know it's the right thing to do.
Yeah, very important work that you're doing. Someone from Maui Memorial also writing in saying, can you help convince them to do more testing and to do more protective? Is there anything that you can do on your side to help the people on the ground there? Because they're really worried.
One thing I can say that is quite positive is I have developed a really strong, almost daily working relationship with Tulsi Gabbard, and we talk, we text, and she is keenly aware of what's going on in the ground. And I am very impressed with her knowledge of what's going on and how aggressive she's taking a stance. So I believe that she's going to stand up again and try to support the people of Maui. I'm also impressed with our Mayor Victorino, and he's just doing everything to make mass testing available. So as per forcing anything to happen in the hospital, we don't have that control. That's something that doesn't come from us, but I think it comes from the public. It's there for the public. We're hearing the staff of the hospitals all reaching out, concerned about what's going on. And I think their voices are being heard. I do think so. Now they're able to take their own protective gear into the hospital. And hopefully, since they have just had like 4 pallets apparently delivered 2 or 3 days ago, there's no excuse that hospital should not be fully geared up with the right amount of protective gear.
Yeah, and I'm just going through all these messages. A lot of them are, Maui people just saying, what can we do? How can we change the mindset there? Because they're really worried about the situation there. I don't know what else other advice that we can give other than just like you said, just maybe putting pressure on the people who
Yeah.
are making those decisions.
Yeah, support. Well, I think you have support at the county level, which is always where it starts on the neighbor islands. I think you jump up to the federal level we have, but I think bottom line is sooner or later, we have to really put pressure on the Department of Health to kind of come up to this century and start looking at what's going on across the world and understand what needs to be done. So I think that's where we all stand right now. We know testing needs to be done. It has to be aggressive. The other myth that is just very disturbing to me is, we have no testing equipment. Of course we have testing equipment. There's always 6,000 to 12,000 tests available at any given time. We're going to have, in another week or two, diagnostics and clinical lab. We're going to be able to perform on island, probably anywhere from 1,000 to 1,500 turnaround tests in one day. We have another 12 to 15 of the new Abbott testing machines, which will give you a 5-minute result. We are fortunate. We are not hampered by testing. The other thing that drives me crazy is I hear in the same sentence, these leaders say, we're going to put strain on PPE if we test. Now think about that. You're saying don't test, that someone's supposed to go home and spread it to their family because we don't want to put strain on the PPE supply? Wrong answer. We need to test, and we need to stop this from going into our extended Polynesian homes in our ohanas that have 10 or 15 people in. I'm just so concerned about those people also.
I did interview an epidemiologist about that, actually, Dr. Miscovich, and he said because the PPE shortage, that would take out the health worker who was actually doing the test. That was his argument, just from that interview. I remember he made that argument saying we shouldn't just be testing carte blanche, right? Because each time you do that swab, it aerosols it. I can't remember the word he used, but it exposes it to the air.
Oh, that is just 100% fictitious and false. And he's a statistician versus everybody we're dealing with are the clinicians that are doing that. That is just absolute 100% not true.
Okay.
So, yeah, I mean, when they say exposed to PPE, they're just talking about that those people that are doing testing are in PPE. I mean, like I said, take the PPE out of the equation. If anybody wants data, if you want to put 10 examples up on the screen for the television audience to see in the future, I will show you the massive amount of PPE that's available to the world right now. It is everywhere, and it can be delivered in 2 to 7 days if we need it.
Mm-hmm. Oh, and your dogs are enjoying our conversation as well. May Raposo wrote that, or is this May or Mel? Mel Raposo says, you know, he's on Kauai. How do we get you to go there? Are they doing
Um,
enough testing there?
you know, in general, Wilcox is quite strong, but they're only doing the drive-up testing. They have not done a broad drive-through testing or walk-up testing, and so I do. I think they have again a strong infrastructure. I think it will be up to the mayor. If the mayor, as I've mentioned earlier, we're going at the invite of the mayors, and I'm very impressed with what Kauai's mayor has been doing in addressing this. And I could have a team there in a second. I think if we did 2 big drive-throughs and we could get another 400 or 500 people that were uncovered, tested over a couple of weeks, we're going to get a very good idea of the prevalence of the disease there. And you know, because again, when I hear that they just announced they had their first community spread this week, that does concern me that there is not enough broad testing. The other thing is, you look, what I want people to do, you know, those maps that are being produced, and you see the reds and oranges and
Yes.
yellows and whites. What I want everybody to do is go and look at the whites. When you have a pandemic like this that is this broad spread, every white area, for example, look at the white areas on Oahu. Wahiwa, North Shore, Kahaluu, or North Shore with Laie, Haleiwa, Waimanalo. What do those represent? Wahiwa, they represent places very high density of Native Hawaiians, lower income. People are taking the bus; they're not driving. It's impossible that there's no positive cases there. So go around the state. Any area you see a white, don't sit and rest and say, geez, we're lucky we have no cases. That just means we probably haven't concentrated enough testing in that area to identify it. So we're going to be now taking it to those communities and not doing as much of these just big, broad drive-ups. So coming up in the next week or so also, we're going to Wahiwa. We're going to be going up to Laie to be doing a North Shore. We want to get to Waimanalo. You know, we did Waianae Boat Harbor on Friday. So across the state, we have I have teams that are go to Hilo and Kona. We're going to be going to Ka'u. We're going to go to North Kohala. So we're going to focus on those areas. Kauai should be thinking the same thing, and we're happy to reach out to help them.
Yeah, so important. I mean, you make a good point. We're seeing, you know, nationally, indigenous populations, dense, urban, poor neighborhoods really hit hard by this, but we're not really shedding enough light on it. And you mentioned, you know, our Native Hawaiian groups maybe aren't getting enough attention on this matter too. What can we do to change that?
Well, basically, you know, what our groups are doing in the private medical community is we're not waiting. I will again say that we're getting a lot of support from the mayors, and we're just going into the communities. We're going into the communities and we're just going to make it available. We're getting the neighborhood boards. A lot of the local representatives, both state senators and state reps, are really behind setting these up. Practically every community-based screening we did, we had the state reps and the state senators all were there helping, and actually some of them were in masks and standing right with us. So we have to go into our communities and support our community leaders to make this happen, and it has to continue.
Are you seeing that with UH Manoa as well, like the university?
I I I
It was a
we
question also, that's why I'm asking.
it makes good sense because I'm working with Dr. David DeRoff from our community health center downtown that we're going to also focus on some of the housing projects in the middle of kind of central Oahu, Kalihi area and things, because we think those are also very untouched, but also very vulnerable because of the type of population and the density. So we're actually probably going to do pop-ups almost in the middle of those areas to try to reach out to those individuals to encourage them to walk up.
Very good. And people are just asking, where can we get all this information? You mentioned all these different testing times and places that you're going to be. Where can we find this information?
Um, I will make it available. We're going to try to get it out to the media. So it's this, just so you know, this morning I've already been on with leadership. I was on with the Mayor Victorino yesterday, probably 3 or 4 times, almost for an hour, and his chief of staff and all his other leaders. I've been on with Maui leaders this morning. It is a very dynamic process, and you know, that's the advantage of having a private group. Let's face it, if we wait for federal or state governments to move quickly, that just is, I'm not necessarily blaming them, but just traditionally they don't have any ability to move quickly, yet private organizations and individuals who have come together for the right reason can. And I can't tell you enough how proud I am of every person who has stepped up in the front lines. The people who have come out, there's not one selfish individual. They're all selfless people that care about the communities. I know the word hero is being used, but boy, these people they've just stepped up, and all they care about is community and helping. And that's what's so incredible about this process for me.
Yeah, and we appreciate you too, Dr. Scott Miscovich. I know a lot of people, we've just getting a lot of people saying thank you to you for your work and trying to lead this. I know it's hard to work with the government sometimes, but again, you've been able to partner and obviously with Lieutenant Governor Josh Green. You guys are partners in crime in protecting our community. So thank you so much for that.
Yeah, sure.
And okay, so I just wanted to say thank you again. I'll let you go back to I've taken enough of your time on this Easter Sunday morning. But I wanted to give our viewers a chance to at least engage with you and hear from you and just give
Sure.
some peace of mind.
Yeah, and I want to leave everybody with some peace of mind. I believe that if you do look at where we are very close to having the top number of tests per capita in the country now. And so we are achieving our goals. And the idea is not just to do testing, but the idea is to identify individuals, to track them, as I said, find them and isolate them. So I want everybody to, enjoy family over Easter, do socially isolate, do remember everything they're doing. I said this in a post I wrote at the middle of the night. Have everybody become their own hero in their own home. Be a hero and spread to your family that it is important to wash your hands. It is important to socially isolate. It is important to not have friends come over the holidays and do pauhana. I know it's nice, but you can maybe still do that if you stay 10 feet apart or 6 feet, more than 6 feet. So everybody have faith, do your part, and we will get through this as a state.
Thank you so much. Dr. Scott Miscovich joining us. Happy Easter to you. Aloha.
Happy Easter to you. Aloha. Bye.